going through all the tough days and the good days with them.
Man, I forgot a lot of stuff. I can tell you that.
From like the sickest of the sick to home care.
So they can go anywhere and they can be there for as long as they need to.
Welcome back to BroncoTales, episode 2 of season 2 with Respiratory Care today. Do you guys want to welcome yourselves?
Hi, I'm Abby. I am a graduate from the Respiratory Care program on campus. I just graduated this past December in 2023. Before that, I grew up in Coeur d'Alene, Idaho, and went and did high school and grew up there, and decided to move to Boise for school and found myself here. And now I work at the NICU at St. Luke's, downtown Boise.
And my name's Trevor. I'm a clinical instructor here on the on-campus program for the Respiratory Care Department. I'm also a double graduate of Boise State, graduated from the undergrad Respiratory Care program, but also the master's program as well.
And what brought you guys both to Respiratory Care?
I originally came into Boise State as a radiology major, just not really knowing my path. Got my AA in high school and came in like ready to apply to a program. My counselor through the College of Health Science kind of explored the options of different programs, kind of as like backups and stuff like that. Ended up getting into the respiratory program, did some research on it, and just kind of fell in love with the concept of respiratory. And that's where I found myself in the on-campus program.
Do you have a specific part you enjoy the most?
For the program.
Or just respiratory care in general?
I love how it's so specific, but you can do so many things within one system. Like the cardiopulmonary system is vast and affects everything in all ages, and you can work really anywhere that you'd like.
And for anyone who doesn't know what the cardiopulmonary system is?
Your heart and lungs.
Okay. What about you, Trevor?
Pretty similar, and I think you'll find that with a lot of respiratory care practitioners. It's not something anyone was really looking for, but it's something you find.
Mm-hmm.
I was on, kind of going to med school PA path, but wanted something that had some clinical experience and some background to kind of guide me in that direction. I'm also unique because my sister's also a respiratory therapist, so she kind of introduced the profession to me in that regard, and started practicing for a few years, started applying to PA school, but then I realized, no, this is actually what I love to do, and I love to teach, and then just kind of everything came together, and love that I stayed in it. So.
Mm-hmm.
Yeah, so other than being a PA, what kind of jobs stem out of respiratory care?
I can start with this one.
Go for it.
So there's obviously, in-hospital kind of aspect where you can work in the ICU, floor cares, but there's outpatient, like Norco's based in Idaho, where you can do a little bit more of the home care. There's long-term acute care hospitals like Vibra that we also staff. But we can work with clinical engineers on developing new therapies and machines that we can give our clinical expertise in to kind of guide their building of them. They're developing new programs called the APRT, which is another mid-level provider for respiratory, really focusing on the cardiopulmonary aspect, like she was talking about, but lots of different modalities, not just the in-house, like working in the ICU with mechanical ventilators, but there really is a lot of different modalities you can work with. I don't know if there's anything you want to add. But
Yeah, just within the hospital, you're not just stuck working in one area. Like, I work in the NICU. I know that Trevor's had a lot of past working with all different ages, adult critical care. You can do pediatric floors. Like, there's really any age range that you'd like, and any from the sickest of the sick to home care to outpatient, stuff like that.
Do you have any specific interesting or kind of heartwarming stories as to why, you kind of reflect thinking back this is I'm glad I'm here?
Yeah. Working with kids is really rewarding. It's also tough. It takes a special kind of person for sure. But I'd say up to now, I got to go on a delivery and take care of a baby that was 350 grams, which is 0.7 pounds, which is just shows how insane medicine is. And just watching kids that are that small grow and going through all the tough days and the good days with them, and then watching them go home with their families is like the most rewarding feeling like you could ever have, for sure.
Yeah, on the adult side, it tends to be, a little bit, probably I'd say less positive in the whole regard, but the most positive things that I got to interact with were like the lung transplants, the heart transplants kind of patients, getting a second outlook on life, getting a renewal of, something we just every day right now we take for granted, just the ability to breathe without any kind of difficulty, and seeing them get a second chance at feeling that and being a part of that is a pretty cool aspect with the job.
Speaking of, taking stuff for granted, is there anything that you guys, after like your education or all of your like knowledge of respiratory care, that you avoid or kind of see differently in your everyday life?
I feel like there's lots of things, like when you hear respiratory, you think of cigarettes and like COPD, chronic obstructive pulmonary disease, like the effects of that. But it goes as far as like traumas, like doing certain things where like, like big fires or something like that can affect your lungs, or just like anything like car accidents, like can lose people's ability to be able to move their diaphragm and breathe and stuff like that. Just so you see everything differently, I feel like.
Yeah, I don't really have much to add to that, but the prevalence of respiratory disease is increasing year by year, so it's something that's going to be more prevalent in more people's lives. So
so what else other than like smoking, vaping, things of that nature are becoming or are prevalent in the whole respiratory industry?
Socially, those are probably the two biggest ones. I think we'll start seeing, potentially some long-term effects from COVID, people who had it a little bit more serious but made it out of the hospital. I think we'll start seeing some long-term effects from that, potentially.
Such as what? Or are you sure?
If they were placed on a mechanical ventilator, or if they had like a serious hospitalization, they can still have detrimental effects to their lungs that are going to could cause some long-term fibrotic changes that they might not feel at the present time, but as they age and as it starts to make itself more prevalent, they'll start feeling the experiences that potentially, again, this is speculative, but that's what I would possibly anticipate.
Yeah, I would agree. Yeah.
Along with like fire, lots of...
Yeah, especially if you have reactive
increased.
airways. The smoke that we're constantly seeing in Boise just increasing is definitely could play a part in seeing more, long-term respiratory issues.
Yeah,
Yeah, we see kids with like asthma exacerbations, or also known as like asthma attacks and stuff like that, where they come into the hospital because they don't know how to control it and stuff like that. With the smoke, it just makes it worse at that moment too. It's scary.
Are those kids put on ventilators, or are there like what are the other processes that you guys kind of go through?
It depends on the severity of kind of their reactiveness and their level of asthma. If they have other like underlying conditions, some kids can have some like delays, or if they were previously like a premature baby, they kind of can have like stiffer lungs, they don't work as well, and they can have reactive airways where they might need hospitalization, intubation, and be placed on a ventilator if their airways close too tight.
But we really try to prevent asthmatic patients from being intubated, putting the breathing tube in as much as possible. So we try things like bronchodilators and steroids and bronchial hygiene, trying to get them to mobilize some of those secretions and prevent any kind of additional work of breathing that they might have. So we try everything we can to prevent them getting intubated.
Can you briefly go into some of those different like steps before a ventilator? Just like what they do.
In terms of asthmatic patients, or just
kind of in general, but...
So we can do we call it bronchial hygiene. So we can sometimes put vests on people that kind of shake them and rattle them to try to mobilize some of those secretions. We can use positive pressure. So we apply positive pressure to the airway through like a mouthpiece and try to shake them from the inside out would be the best way to explain it.
Like pushing air into their lungs?
Yep. Things like it's called cough assist. So it hyperinflates them with pressure, and then it actually sucks it out like a vacuum.
Okay.
We can do participate in physical therapy. Anything that you guys do on the pediatric side a little bit differently?
Mostly along with that, like you can utilize like medication that's nebulized, so it's non-invasive. We have non-invasive ventilation also, to where it's kind of a step before having to put a breathing tube in. It's kind of wearing a mask and allowing to give some pressure and some like breaths to them without actually having to put a tube down their throat, kind of that last step before doing that. We have some medicine that will help open up their airways, albuterol. Some people take it in inhaler form. In the hospital, we usually use nebulizers. But
Which is what?
Like an aerosolized medication.
Okay.
And it can be done with a mouthpiece. Usually in pediatrics, we use a mask because they don't tolerate just using a mouthpiece. It can be used in a couple different ways.
And we were talking about secretions, Trevor. Is that good?
So secretions
fighting off
they can.
particles?
They do have a antimicrobial effect to them, and they're really good for hydration and like lubrication of the airways. But too much of a good thing is sometimes bad. Yeah. So especially when you can't mobilize them and cough them out, they can cause a lot of increased work of breathing. So yeah.
And I kind of want to switch notes kind of back to the academic side. What did both of your journeys kind of look like, and how did you like the programs here?
Like within the program?
Here at Boise State.
Yeah, so I started in 2021, and so just kind of in the Delta variant of COVID. It was really busy. We didn't get to go do our first semester of clinicals because the hospitals were just bombarded with patients. And so we got a kind of a late start on clinicals, and we got to kind of catch up in our second semester. But it was mostly like when you meet everyone for the first time, you're wearing masks, and you're like just trying to like connect with these people and get on the same page. The schooling is rigorous, but there's no lack of support. I feel like within the program, there's faculty like pretty much 24/7. Like if you were to have any questions, emails like back and forth are very quick, and they're willing to come in and help you and stuff like that. But just like the clinical experience is super unique for the program too. You get so many hours in the hospital, hands-on, all of the units. You get to like do Norco, like we were talking about. You get to go there for a day. You're in adult ICUs, neonatal, pediatric ICUs, all the things. So our schooling kind of follows along with our clinical experience, which is cool. So we get to apply what we learn in the classroom in real life. And then we get to the choice to choose an internship where the last semester, we get to choose a unit that we would like to work in. And so we get to do 180 hours and really just focus on what we really love to do, which is really important, I feel like. And then I'm actually in the master's program as well. I just started. And so I feel like that's a good like start, being in the on-campus program, meeting the professors, and then working with them in the next step too.
And is that clinical portion 2 years?
It's along with the program.
Okay.
Yeah. So the 5 semesters. So you get to do clinicals the whole time, which is cool.
To the best of my knowledge, we're the only program that you do clinicals the very first semester you're in the program. So we do kind of a intro to clinicals, about 10-week course where you learn to talk to patients, how do you assess patients, and how do you go through like the safety checks of interacting with a patient. But then week 11, students are getting ready right now to start going doing clinicals, because next week is going to be week 11, and they're going to be doing hands-on patient skills, patient care for the first time, and that can be a pretty intimidating notion.
Definitely.
So I know they're looking forward to do it, but they're probably pretty anxious, but they're going to do great. So.
And how was your time here as a student?
It's changed quite a bit. I didn't have the internship. I wish I had, because I think it's a great, and I haven't heard anybody have like really a negative experience. It's a great way to get jobs for job placement. It's a great way to go, even if people want to work, the students want to work in Boise, a lot of them still leave. They go to places like Duke or Vanderbilt or Boston Children's, Seattle Children's. They go all over. And Alyssa, our clinical director of clinical education, does a fantastic job of setting those up and making sure they can happen.
And these are the internships?
Yeah, the internships. So it's that last semester, 180 hours, 180 hours of, intense direct patient care.
Yeah.
But then they come back, they do a lot of their schoolwork that semester completely online.
Okay.
So they can go anywhere and they can be there for as long as they need to. They can apply for jobs or tech positions, which is kind of like an intermediate between student and professional. So they can, again, continue to build those skills. And I think it's a really unique opportunity, and we really try to empower and support our students as much as possible so that they can achieve the goals that they want. So I think that's what can really help set us apart as part of our program. Not a lot of programs outside of Boise State are doing too. So again, just a really unique, cool thing that I think we're doing.
And how has the transition from after your master's to being a faculty kind of changed your outlook?
In terms of like the profession, man, I forgot a lot of stuff. I can tell you that. That first year was a big shock, like relearning a lot of the things, and then being able to like explain it is just to understand it and to explain it to somebody else so that they can understand it is dramatically different. And just learning how to grow into that has been challenging but really rewarding kind of experience. So. Do
you see yourself continuing as an educator, or?
Oh yeah.
Maybe going back to the hospital?
So I do work.
Somewhat.
I teach part of our clinical, so I am in the hospital teaching, but I also work like PRN at like once a month at a local hospital. So.
Okay. What about the future? We kind of already talked about like with COVID, but any other kind of underlying factors that are going to play a bigger part in respiratory care in the future?
I'll start this one.
Yeah, go for it.
So,
you're good.
So like I talked about, we have the advanced practitioner respiratory therapist kind of starting to emerge. There's a couple schools that have adopted it, and then several of them have been placed in the position. It's kind of letting that shift and mold what that's going to be. It'll be exciting to see what that's going to turn out to be. And just the new advances of technology, I think, are going to be the most interesting and exciting parts to see.
Yeah.
In terms of machinery
and software.
Okay.
I think like AI is I think it's going to aid our job a lot in terms of what we can do and how we can help patients. And yeah, I mean, that's kind of where I see it going.
Do you have like an idea of what it could like help diagnose or help analyze?
Probably mostly like if we're not seeing or like identifying patient needs, like in terms of mechanical ventilation when a patient's on a ventilator, if we're not meeting some of the criteria, we can get more instant feedback rather than some speculative work, if that makes sense. That's where I see it improving mostly. I just don't ever see a reality of where you're never going to have somebody hands-on in the patient. There might be some advances where you have to do maybe less than you did, but it's always going to need human expertise to
kind of it's just there to confirm.
Yeah, that'd be a better way to say
what you're
yeah,
seeing.
Exactly.
Okay.
Yeah, probably technology is the one that I can see. Obviously, it's advanced always. It's always advancing. But we're already like seeing new stuff in the last year that I've been working. Just new ventilators, new settings, new research, even like not technology-wise, just people are like researching more about respiratory. After COVID, I feel like there was a heightened interest in kind of like, what is the cardiopulmonary system? Why does it do what it does? And especially in the neonatal world with like preemie babies, there's just so much more information coming out that we didn't know before. There's like the survival age now is like 22 weeks when it used like 20 years ago it was 28 weeks and like that was a preemie baby. But now we just have protocols and things that we're just learning so much about that we can apply and just help like aid all those steps and make sure we're doing the right thing.
Do you see yourself staying in the NICU?
For now, yeah. I really, really love the NICU. After I graduate with my master's, I don't see myself leaving bedside right away, kind of just keeping it. And there's so many opportunities for online teaching and stuff like that. And so if I wanted to maybe help with like an online course or something like that, and I'd love to go into upper hospital management one day and maybe do like something along those lines.
Yeah. Do you guys have anything else? I have one last question, but before that.
No, nothing that's popping in my head. So.
Yeah. Well, this one might be a tough one, but do you have any long-term goals? You kind of just mentioned one, or like 5-year goals, kind of either, however, if you have any.
You want me to go first?
Yeah.
I kind of explained that. Obviously,
Yeah.
completing my master's is like a huge goal of mine. I'd be the first person in my family to ever get a master's degree. So that's really important. Thank you. And I just think that would be a great step in kind of opening the doors to a lot of different things, teaching, management, all those kind of things. I know that I want to keep working bedside, but I want to get my neonatal pediatric certificate as well in respiratory. It's another exam that you can take, and it's like a specialty course to kind of go along with my license and hopefully become a preceptor to kind of help students as well. Would be a goal of mine.
Yeah.
So my 5-year plus kind of track is staying in education and then probably going to get my doctorate in education, and then just try to keep putting out graduates like Abby, who are fantastic and killing it. So
that's the goal. Awesome. Well, thank you, Trevor. Thank you, Abby, for being on the show with us.
Thank you.
Yeah, thanks, Sam.
Yeah, I learned a lot about respiratory care, and I hope everyone listening did as well.
Yeah. Perfect.
Thanks.